Hello, my name is Nathan. I'm one of the level 1 students here. I was wondering if I could follow you and ask you about your SBAR report for this patient in 620.
Absolutely, Nate. My name is Matt. This is Mr. Restivo, Levi Restivo. We're in room 620. He's a patient at Dr. Phillips. He was admitted from Dr. Phillips' office. He was found to have, he's been having some increased blood sugar over the last 5 days. Dr. Phillips saw him in the office and decided he wanted to get him in to be seen. He came in through the emergency room. They found him to have a blood sugar of 310 at that time, and he's gone ahead and come up to the floor. Mr. Restivo here was found to have an A1C of 8.2. That's going to mean that over the last 90 days he hasn't really been maintaining his blood sugar very well. He's a non-compliant diabetic. They also found that part of the problem is Mr. Restivo has been increasingly bed confined, so he's developed a stage 2 ulcer to his right heel. So we're going to go ahead and manage that. We're managing that right now with some dry sterile dressings. We're waiting for a wound care consult to come through on that. Other than that, he's been ANO times 3. He's had some generalized weakness, so we've got him on some bed rest at this time. Also, he hasn't had any cough, wheezing, or chest tightness. As far as allergies are concerned, we're going to double check with him right before we get in there. He has no He's got allergies to tetracycline, peanuts, and dog hair. But we'll go ahead and we'll double check that with him before we go ahead and give him any medication. As for diet, we have him on an 1800 diet. Means we don't want him to eat more than 1800 calories. And we also want to try to maintain him to 2 grams of sodium at any point in time. His in and outs have been pretty normal. He ingested 320 milliliters and he outputted 320 milliliters, and that was about 350 today. Other than that, we have an IV in his right AC, and we've got consults out for physical therapy, occupational therapy. Case management is going to look into him to find out, if this maintenance of his blood sugar is because he can't get access to it, or, what the situation, if anything that we can correct. As far as his vital signs have been good. He's been running a low-grade fever. His initial fever at 450 was 101.4. It's come down a little bit to 100.1. We believe that that's probably to do with his heel ulcer. That's part of the reason why we're giving him an antibiotic. The blood pressure's been good, 132/70. His pulse rate was 76, and he's sat 96% on room air. As far as his other lab values, we're a little concerned because his platelets were elevated. Like I said, we believe he's got some kind of an infection going on. His platelets were not his platelets. His white blood cells were elevated at 19,000. Also, his hemoglobin was a little low, so we're going to go ahead and monitor that. It's part of the reason why we're watching his blood pressure at 10.4. Some of our follow-up planning is going to be, we're going to repeat his CBC and his CMP on Wednesday at 8 o'clock. And his wound care consult is going to be at 4:45, which he should have already had, but I didn't see any notes in there from them. So we're going to try to follow up on that, find out why they didn't come in. Last blood sugar I had on him was 290. So when we go ahead and give him his insulin, that was taken at 4:45. So about 10 minutes ago, we'll be able to use that. The medicines that we're going to give him today, he's due for his 5 o'clock medication. It's going to be his insulin regular. He's due for vancomycin. The insulin's going to be going off a sliding scale, and we'll check that and verify it based off that blood sugar at 290. He's going to be receiving his vancomycin, 1,500 milligrams and a 250. And we're going to try to give that to him over 2 hours, is the way it's ordered. He's also ordered for lisinopril, 10 milligrams by mouth. I also got reports from the nurse that we haven't hung his saline yet. He's got orders for saline, 30 mLs an hour as a maintenance fluid for him.
Normal saline?
Normal saline, correct. 0.9. Do you have any questions?
Yeah, why is he getting those medications?
So he's receiving the vancomycin, like I said, because he's been running the low-grade fever, and he's got the elevated white blood cell count. So with the insulin, we're going to want to make sure with the vancomycin, it's a broad spectrum antibiotic, the glycotide antibiotic that we're going to give him. We haven't really gotten any result backs from his cultures, but what we are doing is we're just kind of treating him for that. And we're going to need to monitor with that and make sure that he doesn't have any signs of an allergic reaction. When I asked him, he said he's never had that medicine before, so we're going to be awfully careful with it and make sure he doesn't have the allergy, just because he has had the allergy to tetracycline before. Also with that, we're going to want to keep monitoring his blood pressure, his heart rate, for signs of an allergic reaction, and we also want to go ahead and monitor his temperature. With most of these medications here, we're also going to want to monitor his liver function and his kidney function through his BUN and his creatinine.
All right. When should you not give this medication?
The vancomycin, we wouldn't give it to him if he has had signs of kidney or liver failure. We also don't want to give it if he's ever had an adverse event to vancomycin before. The other two that we're going to give is lisinopril and insulin. With the insulin, he's receiving that because he has hyperglycemia. Like I said, he's been a non-compliant diabetic, so we want to go ahead and we're covering him with insulin based off of a sliding scale. With the insulin, we want to be pretty careful. It's got it's a rapid-acting insulin, so he needs to make sure that he eats his dinner within 30 minutes. So I'm going to make sure that he's okay to eat his dinner beforehand, within 30 minutes of taking it. We're also going to want to make sure we check a blood sugar within 2 hours after we give that. The lisinopril, he's receiving that. Lisinopril will help with his blood pressure. He did have a history of hypertension. He was hypertensive a little bit, but also he's had some numbness and tingling, and he's had some tingling in his feet. So we're concerned he's got a little bit of diabetic neuropathy. So the lisinopril is actually going to act as a vasodilator, and it'll help perfuse his feet. One of the concerns that we're going to have with that, because it can have an effect on the blood pressure, we need to monitor his blood pressure closely. We also need to be careful and make sure he doesn't have an adverse allergic reaction to that medication as well.
What interventions would you teach them to ensure the medication is administered safely?
So we need to make sure that we're giving the medications as per their order, that we have the correct patient. So we're going to want to make sure we have the right patient, the right med, the right route, the right time, and the right order. So we can verify all that through talking through the patient and looking at his MAR. I've gone ahead and I've confirmed all these medications with the order that are in the MAR, and I've also confirmed that these medications are within normal range for this patient.
Oh, okay. How would you know that the medications are effective when you give them?
So the insulin, what we're going to be looking for is going to be a decrease in the blood sugar to bring it down to within a normal range. We've been trending down with the blood sugar, so he's obviously responding to this one, but like I said, within 2 hours we're going to need to check it. The vancomycin, we're looking to see the fever to keep coming down, and hopefully he doesn't progress any further with the signs of infection. He doesn't become tachycardic, he doesn't become any more febrile. And we'll also be looking over time for his white count to come down to normal limits. The lisinopril, it'll decrease his blood pressure slightly, but we're also hoping that the tingling in his feet will go away as well.
Okay. Thank you.
Okay. All right, so we're going to go ahead and give him some medicine. Hi, Mr. Restivo. How are you doing today? Mr. Restivo, can you talk? Mr. Restivo.
Oh, hey, what's up?
Hi, how are you?
I'm doing okay.
I'm Matt, and this is Nate. Nate's a student nurse. We're going to be giving you some medication today.
Okay.
You mind if you just tell me your name and date of birth, please?
My name is Levi Restivo.
Well, they don't have your date of birth here. How old are you?
67 years old.
67, all right. So I'm just going to take a look at your band here. Mr. Steve, I have that you're allergic to tetracycline, dog hair, and peanuts. Are you allergic to anything else?
No, that's it.
No. I've got some extra stickers here. I just want to make sure I have the same number written down, because our barcode scanner's broke today. I do have the same number written down on your stickers that I got from the other nurse. So we're going to go ahead, we're going to give you your lisinopril, your vancomycin, and your insulin. I heard your blood sugar's been a little elevated.
A little bit.
Okay. All right, sir. All right, so if we look here, Nate, we're going to be giving him his insulin, his vancomycin, and his lisinopril, right? Also, he doesn't have the saline hooked up, so we're going to go ahead and get that hooked up first, okay? So the first thing we're going to need to do is we're going to need to confirm he is. Like I said, I've already confirmed this band with him because our barcode scanner is broke. And let's go ahead and grab his saline now. The barcode scanner's not working.
They try a different band. Maybe that band's not working correctly. That's what happened last time I was in the hospital.
No, I have the number typed in incorrectly. Let's make sure this band number is the same. Oh, it's a different number. Oh, it's not the metal correct number actually. There we go. You're looking at the wrong number in there. All right. Mr. Estevo, how's your IV been feeling?
Good.
I'm gonna go ahead and I'm gonna clean it and make sure it's still good, okay?
All right. I'm gonna scrub this for 15 seconds to make sure it's good. Pull the cap off. I'm gonna connect. And we'll be checking for signs that it's infiltrated. Is it swollen or not? There's no swelling, no redness. Does it hurt at all when I'm pushing this? No.
No? Okay. Alright, the IV looks good. You don't have an IV pole. Let me go find an IV pole. I'll be right back. So we're going to go ahead, we want to try to keep this from touching the ground. Hospital grounds are not very clean. And we want to try to keep this sterile. So when we pull this stuff off, we want to make sure we don't touch the inside of it. Right. So we're going to get some fluid inside the drip chamber. We'll use the bag to plug over the rib so we don't make a mess on the floor. We're going to let all the air come out of it until we get a couple drops of fluid. Go ahead and close it. Now, we don't have an IV pump, so we're going to use what we call a dial-a-flow. We're going to go ahead and turn this to flush. And then again, just like the other one, we want to try to keep these pieces sterile. Go ahead and scrub the hub again, 15 seconds. And then go ahead and connect your drip set. Now he's going to be getting this at 30 an hour. So until we get everything else set up, we're going to set this to 30 an hour. Did you see this, Nate?
Yep.
At 30.
Cool.
And we can go ahead and open this. And we want to make sure that bag is elevated above him so that it can infuse because it uses gravity. We'll go ahead and document this. And we have the green, so we can go ahead and give that. Now that we're going ahead and we're messing with the IV, let's go ahead and finish up the rest of our IV medications. We're going to go ahead and do his vancomycin now. Let's get his vancomycin out of the drawer here. We're going to, just like we did with the saline, we made sure the expiration was good on that. We're going to make sure the expiration's good on this, and we're going to verify the drug.
Anything else?
Again, we have green. Now this is going to be given as an IV piggyback, right? And this says that we're going to give the 1,500 milligrams, and it's going to be given over 2 hours. So this one we're going to go ahead, we're going to need to set it up as a piggyback. Go ahead and hang that there. And go ahead and shut this down. Close our roller clamp. Now because we're giving this as a piggyback, we're going to need to lower the normal saline. Now I don't know how the other nurses show you, but this is the way we need to hook these up. Same thing with this, we don't want to contaminate any dirty spots here. We'll go ahead and spike the bag. Now we want to be careful with this because every drop of this medicine counts, right? So we don't want to waste any of it. So as soon as we get one drop, then we're good, okay?
Anybody can tell me your name and how old you are?
And we want to make sure that we have up to this little line in here. Now because we're going to be giving this as a piggyback, we're going to go up to the spot, we're going to scrub the hub, and then we can connect our tubing. And scrub the hub for 15 seconds, right? Now we can go ahead and open the roller clamp. Because this is going to be given over 2 hours and it's 250 mLs, we need to give it at 125 milliliters an hour. So we'll set the dial flow to 125. Just verify that it's running. Alright, now we got a couple drops.
Let's see the drops. There we go. Now.
Alright, go ahead and document this. Now we went ahead and we checked his sugar. His sugar was 290. So he has an order here for insulin regular. If we look under his sliding scale at 290, he's going to need 16 units of insulin. Right? We'll go ahead and pull up the insulin. Let's go ahead and grab the insulin. So for insulin here, this is regular insulin. We're going to check the bottle, make sure it's right. We're going to check to make sure this one should be clear. And we'll check the expiration date, which is still good. We don't want any cloudiness or anything in this insulin. Again, we'll verify the name of it, and we'll verify through our broken barcode scanner. Alright, and we verified the medicine. Again, we're going to go ahead and confirm that he's going to receive 16 units of insulin because of his blood sugar of 290. Right? Because this is a brand new bottle of insulin, it's got a cap on it, we won't need to clean the top of it. We verify that we have an insulin syringe and that the insulin syringe was within date. We're going to drop 19 units of air. And still 19 units. We have 19 units. We're going to go ahead and get all the air out of it. And we're going to recap. Remember, when we recap, we don't want to put
Oh, that's actually pretty cool.
hand on it. So now, because you're a student nurse, I'm going to have you go ahead and verify it with me.
Alright, so in here you drew up 16. You said 19. Did you want to do 16 or did you want to do 19?
You're right. Let's go ahead and make that 19.
What does it say on the mark?
Oh, yeah, you're correct. 16. Yep. Yeah, I kept saying 19, but I drew up the right amount. Correct. Alright, again, 16. You drew up 16. Say one thing, do another. That's why we always double check, right? So we're going to ask Levi here. Levi, where was the last place you received your injection? Levi doesn't talk much.
Oh, it was in my abdomen.
Where at? Can you point to it?
My bottom right.
Alright, so we're going to go ahead and use a different site. We don't want to use the same site over and over. So we're going to go ahead and clean. And with insulin, we don't need to withdraw. So he doesn't have a whole lot of fat, so we're going to go ahead and pinch. And we'll go ahead and retract. And then this needle, we're going to go ahead and discard it. So we go ahead and document that we gave it to him in his left lower quadrant. that we gave 16 units.
Click on the mark and click on the green dot.
And the last pill here that we have to give him is going to be lisinopril. Get that out of the room. Again, we're going to check the expiration date, make sure the bag states the correct drug. We have the right one. Now, Mr. Estivo, have you been eating and drinking at all today?
Yes.
Alright. I'm going to give you, we're going to sit up just a little bit. Pearly whites you got there. Alright, I'm going to give you a little bit of sip of water. Can you go ahead and try and drink that? Good.
Gulp.
Now, can you take this pill from me? There you go. And then he'll take the pill, and here's a little bit of water to follow that. Can you go ahead and open your mouth and show me you swallowed it? Good. We'll go ahead and document that we gave him the pill. Alright. So Mr. Estivo, I went ahead and I printed you out some information on your condition, so you can go ahead and let me go grab that from this table right here. So you can go ahead and follow up on it, and you can know about your blood sugar and all that, okay? There you go. Sit that right there. Alright. Do you have any questions for me before we leave?
Yes. 1 second. Were there any pertinent pieces of information you reviewed before administering the client the medication?
I'm sorry? What?
Was there any pertinent pieces of information you reviewed before administering the client the medication? What did you review before giving the med?
Absolutely. We had to make sure of his blood sugar. We needed to make sure that he wasn't allergic to any of this. We needed to make sure that we verified not only that the order in the MAR was correct, but I had to go back through and verify it with the orders of the physician.
Did any of this information affect your decision to administer it?
No, not in this case it didn't, but we always make sure we verify because doctors do make mistakes too.
Oh, okay. And the information, did it affect like how you administer it?
No, none of this information. The only thing that was going to affect it is going to be his blood sugar, and that's going to vary his insulin.
Oh, okay, so that's why they give the sliding scale.
Correct.
Oh, okay. Now I understand.
Make sure we don't over-medicate the patient.
Well, thank you very much for showing me up how to give that medication. I learned a lot today.
All right, thank you.
Thank you.
And wait, we got to wash your hands on the way out, right? Ladies and gentlemen, always wash your hands.